Hello? Can everybody hear me? Yes. All right, I'd rather talk loud than use a microphone. My name is Ben Brandis. I think we made brief introductions earlier. I head up Grant Thornton's private equity practice. We invest in or advise investors in a lot of different industries, including home health care, senior living facilities, products for the aging market, etc. So I am pleased that we have this panel here to talk about some of the challenges, opportunities, and things that they have found, in working at their companies for servicing the aging market. Before we begin, let me just talk about how we'll structure this, because there's been a lot of talking on this side and not yet any interaction. So we'll have some brief 2 to 3 minute introductions, one slide at most per participant. I will ask one question, they'll be answered by everybody, and then we're going to open it up. So this portion on our side will take maybe 15 or so minutes, and then we'll open up, and then we'll have about 30 to 40 minutes to answer questions and have a good interactive discussion. So with that, I will turn it over to immediately my left, Will.
So I'll be very brief. You heard me talk a little bit about the Entrepreneur in Residence program that we created about 9 months ago. And the genesis of the program is obviously being the largest senior living provider in the country. My team gets calls literally every day from a startup company or even a large established company wanting to offer their products and services to Brookdale. And what we found is that a lot of those companies didn't understand the market, and they didn't understand the consumer. And so we created a program whereby we allow entrepreneurs to come into our communities. Right now, they're spending a week living in the community, participating in the activities, eating in the dining hall, engaging with the residents and trying out their products. We've done 5 to date. We did a care management, family engagement program called Kimberly. We did a program called Narrative Apparel, where a woman designed clothing that was easier for seniors to get on and off in a way that maintained their dignity. We did a program with a company called Haystack Dryers, which took hair drying, put into bathrooms for seniors, knowing that their skin is sensitive, so using towels can be abrasive. A Canadian company called 3Scape, which was designing therapeutic film out in Seattle for people with Alzheimer's and dementia. And we just completed a project with a company called Remo that had wearable sensors, devices to control a smart home that works with Samsung. And so we've got several more lined up. Really exciting project, but I think the insight for us in all of this, again, as I said before, you've got to design with, not for the senior if you want to provide the services.
Continue, let me see if I can. We're on to the next speaker. You told me to be fast.
Yes. So your agenda says that you're getting Seth Sternberg tonight, one of the co-founders and CEO. In fact, you're getting me. I'm Kelsey Mellard, and I lead all of our health system integration for Honor. The way that we think about the aging space in general is really starting with the care professionals who take care of those seniors. So if you think about the industry that we specifically specialize in, Honor, is non-medical home care. So we heard Kimberly talk earlier this evening about what keeps people staying active and being well. It's the activities of daily living. It's probably the things that all of us took for granted by the mode that we got here, the mode that we woke up this morning, the fact that we showered probably by ourselves, all of these things that we can do on our own. And so we focus on providing those exact services into the senior's home, but starting with really the care pros themselves. So we actually call them care professionals. This industry, this part of senior care, is a $30 to $40 billion industry. on its own. To put that into perspective, the taxi industry in the US is 11 billion. So this is just one tiny segment of the senior caregiving space that we have at our fingertips today. But we actually employ our care professionals. We only accept about 3.5% of them onto the Honor platform. And if you think about this labor pool, about 56% of these individuals are on some sort of government assistance or welfare. So we, as our society, have this expectation that we're going to send these individuals into our seniors' homes to take care of them when they're coming from a really unfortunate place themselves, not only socioeconomically, but they're oftentimes sick. So in our technology that we've developed to deploy them and to match them with seniors, there's actually a sick button where they can hit. And this was a huge eye-opening experience for us when we started working with this labor pool, so that we could actually give them the autonomy and the decision-making authority to say, yes, I'm sick, it's probably not a good decision for me to go to work today and care for our seniors. So we do all of this through a technology-enabled platform, but most importantly, we are a human services company at the forefront of what we do every day.
My name is Rich Ziemianski with Integrity Insurance and Financial Services. We're an exclusive general agent for Blue Cross Blue Shield. So where we specialize is helping individuals once they reach 65 and go on to Medicare and to protect themselves out of the Medicare supplements, prescription drug coverage, but we also actually help fund a lot of these folks here. And the challenge that we find today, and you'll see in many of the slides now, is that it's very likely that when we're planning that an individual, either a husband or a wife, will make it to 83 or 85. And typically, once they reach that 85 mark, there's a very good likelihood that they could live another 7 years. So the fastest growing segment at this point right now in our population is actually the 85 plus. So where our challenge is today is that when people are having limited resources, whether it's 401ks, they're planning for the retirement years, their lively years, but what we're finding is that they want to do all these things as far as traveling and all of that, but if they end up living to 92, and especially with modern technology, if then all of a sudden things get even better and we live to 100, now at that point, where do these assets come from to cover all of these areas? In addition to that, what we find is that, like the other folks were saying before, is that when you're looking at the 65 up population, we handle people very differently at 85 plus compared to 55 to 65. We find the 55 to 65-year-old is definitely more tuned with technology, whereas the 85-year-old is not as much. So the challenge also comes into with our call centers and making sure that a lot of the millennials that we have, that we've hired, and as many of us have went to dinners and you see all the millennials sitting around and none of them are talking or communicating, they're all on the phones. So we find we have to do a lot of education in getting these prepared, these folks prepared to know how to talk to these different types of groups.
Okay. We have millions of calls and contacts from customers every year. And what I can tell you is, like everyone up here knows, it really is a privilege to serve seniors, and it's like nothing ever, like no other type of business. And I put some real customer, kind of human element to what it means to serving seniors up on the screen, and these are all real. These are all real customers, real customer communications. So, for example, gone are the days where you try to force people to take electronic billing, because sometimes they actually want a paper bill and they want to send you a check in the mail, and that's the way they want to do it, and you're not going to change that. The other thing is, it's absolutely gorgeous when you get a love letter. It's like, "Dear Mrs. O'Loughlin, this is a love letter." I'm like, whoa. Really, it's incredible. And it says, "I never thought I'd fall in love with the service, but I did. And it's the people behind the service that matter." And they write you your complaints, they write you the love letters. It's part of how they engage and how they engage with a company. And the one in the middle there in the red is a customer who actually wrote us a note and sent a picture of her dog Buttons. They think of us as family. And they want to build relationships with companies that they want to put their trust in to be a family to them. So you heard earlier that service excellence is really critically important, and it is. And that's a customer hugging one of our frontline associates. How many times what kind of industries do you think of where your customers call you up and say, "Can I come visit you? I'm coming to a Patriots game and I need to come. Can I come and meet the people that helped save my life 3 times?" Wow, yes, you can. And so customers come and visit us. And another key thing to understand, and it was mentioned earlier, is quality is really important. And it's as important, or if not, our studies say it's the highest ranking consideration for purchase is about quality. And meaningful innovation is critical. We can give all the products and services in the world, but if it's not meaningful and if it's not easy to use, then they're just going to discard them.
Desktops. Now, not only are people here in the United States using mobile devices, their smartphones and their iPads, more importantly, internationally, people are using and relying on smartphones and mobile technology much more so than we do here in the United States. So how we service seniors needs to be looked at in terms of what we do now and the potential, what's going to be happening in the next couple of years. In addition, the services that we provide themselves are actually changing. One of the other things that we've already touched on is the fact that we have a lot of really great technologies that have been developed. We also have the seniors who are actually halfway hesitant to actually adapt those technologies. So how do you develop a company and a platform for seniors and for their caregivers that you can use today and you can prepare to grow with the market? Because we know that as the seniors age and they become more technology savvy, they're going to rely on technology more and more. One of the things that's been very successful for making care easier is the fact that we've developed tools so that, number one, we approach the caregivers who are helping those seniors. The caregivers are more apt to use the technology themselves. And number two, we provide useful tools so the technology does more than just communicate. It helps people take action. And so what we're trying to do is find ways that we can create better care using technology. And we're creating ways so that we can use that technology now, and then as the market changes and the market continues to grow, we can adapt our technologies to anticipate what those future needs are.
Great. I have a new question now based on this. But I'll ask it, and we can go down the line, starting with you, Renee. I'm sorry, Julie.
Sorry.
Same.
We're only a year apart, so
Yeah.
I'm used to that.
And then we'll open up to the audience. What's interesting, I think, about this panel is that we basically have 3 truly entrepreneurial companies that have been recently formed, 2 extraordinarily established and brand name companies, and people have been at the companies at various points in time. So based on that experience and the difference in these companies, my question is, since you've joined your respective firms, what misconception or mistake was your company making in servicing seniors that has since been rectified? Julie.
So I've been involved in the elder care industry now for over 15 years. And when I started, we were really dealing with seniors. And when I talked about a senior, I was talking about somebody who was 70, 75. And when we started to approach that market, we were looking at seniors. One of the things that we learned in our first year or two is the fact that the senior market represents a much larger group. And so it's not only the older seniors, like the 75, 80, 85, but it's also the 65-year-old people, the caregivers themselves. And so finding out who to market to was the one thing that we really honed in on and really refined, and that helped us a lot, because with our caregiving platform, the patients themselves weren't apt to use the technology, but by identifying the caregivers and really targeting the caregivers and moving our model and pivoting towards that, we were able to reach a bigger and broader market.
I would say the change that we made was shifting from focusing only on the seniors to focusing on the seniors, caregivers, and clinicians, and realizing that it is an ecosystem and opening up the door to partnerships.
I would say from our end, what we've continued to find is that things get more and more confusion out there with the Affordable Care Act and the fact that now people are now responsible for making their own financial plans, whereas before you had pensions in place, before you had health care that was being provided by a lot of corporations. Now that's completely gone away for a lot of places. And so I would agree with you. It's about a whole team approach now, and we've become more advisory driven and educational than ever before. But on top of it, from a customer service aspect, we still actually pick up the phone live within our call center in itself, whereas a lot of it is automated, and seniors don't like that. And so we do a lot as far as making sure that call is handled in a very fast manner, but also that you have the right people on that knows what they're talking about, because definitely the seniors today, there's a lot of wisdom there, and they know when you're telling the truth or not, so you really have to be trained properly.
I would say there's probably two misconceptions that we've kind of come to terms with over the short period of time that we've been operating, which is about 10 months in the San Francisco Bay Area, and we're also operating in LA. One is that I think people kind of shook their heads at our founding team, who are all multi-time entrepreneurs but rooted in tech, saying, good luck, these guys and gals are going to have no idea how to deal with this labor pool, because they're not going to show up to work on time, and they're going to be the worst labor pool that you've ever seen. And what we found is that's absolutely actually not the case at all. If you treat people with respect, and if you give them technology and tools to actually be really successful at their jobs and incent them in the right way, they're going to perform like superstars. The other thing is that seniors actually don't see themselves as seniors. So my mom is 66 years old. I just ran a half marathon with her last year. And I was giving this presentation, and I said I have an aging parents who my mom lives in Santa Fe and my dad lives in Kansas. So I said I have aging parents who live thousands of miles away. And she asked one time what I was doing at work, and I said, oh, here's a slide deck, Mom, you can see what I'm up to at work. And she was totally offended and appalled that I called her an aging parent because she's Medicare eligible. So I think we also have to remember that no one sees themselves as the person needing this or even classifies themselves as the senior. And then I would just absolutely echo that while we can have all of this technology and while we have incredible engineering teams and capabilities on that front, we have an entire telephonic support team because our seniors and our family members still want to pick up the phone to say, how did Mom do today?
Yeah, the misconception that we had probably 7, 8 years ago was that the internet was a fad. In our industry, quite frankly, it honestly is a lead generation channel for us. The industry was all driven by word of mouth, by walk-in, by local community outreach. We actually had sales associates that would not work internet leads because they thought they were, just people fishing around for something. And as we've seen over the last 7, 8 years, the shift is probably our number 1 or number 2 highest generating lead source. And that's because, again, I think you've got multiple people involved in the decision-making process. It's a complicated product. People don't understand, as we talked about before, what does it mean to live in an assisted living community, an independent living community, a memory care community, a skilled nursing facility, a nursing home, a CCRC, a life care community, home care, home health, therapy. All of those terms are confusing, and And quite frankly, they mean different things in different states even. And so the internet has become, is obviously a wonderful source of information. And we're seeing more and more people going online, using that not only as a tool to shop, but also as a tool to buy.
Great. Should we change the name of the event? Maybe our experienced market or something? I don't know. Debate later. On that note, let's open it up for questions from anybody, and I think that there should be a button on the microphones if you want to talk, or you can just yell up there.
Yeah, I'll just yell. Can everyone hear me? Yeah. Okay, great. We often think about servicing seniors in the home or in the hospital or wherever they live. But I've also read that a lot of seniors, if they could, they would want to continue to work. They just need more flexible hours or other things that kind of suit them. So what about servicing seniors in the workplace? Have you guys thought about that, and what are some advice that you could give us?
We're maybe the youngest company on the stage, so we have a long way to go in regards to evolving our platforms. So we absolutely think about this because oftentimes the people that we care for in their homes, they don't want to be taken care of by someone 30 years younger. They want to be taken care of by a peer who maybe just have similar capabilities or similar interests. So from an interest perspective and from an alignment, it's absolutely something that we think about. Are we evolved as we want to be in this specific area of employment and flexible job opportunities, targeting this group of folks who are soon to be retired and don't really want to be retired yet and still engage in their community? No, but I would say more to come on that front. Great question.
It's not something that we're doing at all very well yet, or not even, I would say, at all. But it's aspirational, because if you listen to people like Airbnb and others, that if we live to the vision of supporting seniors and living engaging, meaningful lives and contributing to society, we want to figure out and listen. We're in the listening and sorting out stage, and how do we do that, and what does that look like for them to have, I didn't think of it as work necessarily, but contribution and engagement and participation. So it's something we are sorting out and interested in talking more about.
Yeah, I think from our end, what we're seeing a lot now is that many people are going into second careers after 65. They had their primary career, and what they're finding is in like one speaker I saw was it's kind of like getting like Groundhog Day for them when they retire, and they're on the golf course 5-6 days, and that becomes the only thing that they're doing. And so what they're really wanting today is to have some sort of substance, whether it's volunteering, whether it's just working a day or two a week. So we have to find that we have to adapt to their schedules now. They're just as busy as us, if not more. And I know what we've been finding a lot, and we're in Chicago, so a lot of people love to get out of Chicago. So our call center typically gets busier after winter is ended, as these folks are coming back from Florida and Arizona. So we have to find, we're adjusting around more their schedules now at this point, because they're much, much more active today than ever before.
Good. In the bottom, go. Yep.
Several of you have businesses that are based primarily on internet or some kind of information technology. And I think Julie and Kimberly and Kelsey in particular, there's all this technology. And I'm just wondering how regulation fits into all of what you do, or if regulation hasn't caught up with what you're doing. And if I go to a hospital, it's very regulated. Insurance is always regulated, so probably, it may not be all that different than it's been 20 years ago. And I don't even know how to formulate the question, but we're talking about delivering care to people, and a lot of it is healthcare related. So what is the government doing about this, or can it, or is it bothering you, or what?
It's a very real issue for me, of course, because we choose to have high quality, high premium products and follow FDA regulation, but not all my competitors do. And it's complex, and so we need to sort through what this is going to look like in the long haul. And legislation is changing in the areas of things like enabling telehealth. So if I can tell that mom's got an emergency, is going to go to the hospital in the next 30 days, what do I do with that? I want to be able to potentially access a doctor or a nurse and have that be something that the doctor or nurse can actually get compensated for, as opposed to worrying about state lines and these sort of things that are really make the picture pretty messy today. So I think we have a long way to go to streamline and simplify this and level the playing field.
Okay. Julie, you have something to say?
Oh, no, I was just going to say that we are completely online with HIPAA and making sure that we protect health information and provide secure information. That drives what tools that we offer. And just like Kimberly had said, there are additional things that we would like to do, but for security reasons, at this point, we kind of pulled back, waiting to see where the legislators are going to take that. And because for us, our priority is protecting the information of our customers and our clients. And what we want to do is make sure that we protect them first and then react to what the government's doing next.
I'll just go to the side of the room first. I'll go front first.
I'm with a company called Vigorous Mind. We work with senior living. And one of the main challenges that they're telling us about is shortage of staff. And this is only going to get worse. I'd like to hear your opinion about robots for care.
There are a lot of companies actually that have come online in the last several years that are trying to put robots in communities. We're currently not working with any today, although we're confidentially in conversations with some to look at pilots. Where we see opportunities is around sort of assistance and reminders, around medication reminders, reminders around sort of nutrition or hydration, companionship, other opportunities to leverage technology and leverage sort of robotics. But I think your point of the challenge of the shortage of caregivers, one can be enabled by technology, whether it's robots specifically or assistive devices that allow care staff to be more efficient with their time. As an example, one of a project that we did was using real-time location sensing, putting on name badges on nurses that were doing nurse rounding as a way to drive compliance with a standard to round on a patient every hour. And what we found is we improved productivity dramatically simply by creating transparency into how much time a nurse was spending. And if a nurse had to spend extra time with a patient, the opportunity then for another burst to step in and backfill. So I do think technology has a huge role in increasing the efficiency. I do think robotics has the potential, but it's a real.
I'll just go first on time.
I have a question about the education you mentioned previously. So when you talk about like elderly consumer need more education to driven their decision to purchase some services or not. What is the channel that you commonly use to educate the elderly? Because they're more fixed in certain type of features, or what is an easier channel for them?
So, sorry, I'll jump in on anything. So, I think for us, for educating the elderly is a twofold approach. Number one, not only do you have information online, because we're finding that educating the caregiver, we empower them to become the educator for the elderly patient themselves. But more importantly, we also have additional information, printed information, and then we have information where we can reach out and contact the patients themselves and walk them through. Because one of the things that you've heard from all of us is the fact that the seniors and the elderly want to be able to pick up the phone. They want to be able to reach me. They can't, they had an email on a care update that they wanted to double check, and they want that person-to-person contact. And so making sure that we can communicate on the level that they're familiar with and they're comfortable with, most of the time for us by the telephone and a live person answering, it has been really key and successful for us.
I would say another channel, I mean, we were joking about the internet, but obviously there's too much information, quite frankly. It's not the fact that there's a lack of information about all these issues. There's a lot of information, and it's hard to understand what's the right information. The best channels, I think, and we don't do a good job of this as an industry, is educating the physicians and their nurses. If you talk to primary care docs, they don't have an understanding of the difference necessarily between independent living, assisted living, Alzheimer's and dementia care, and skilled nursing, and what can be done in an assisted living environment. And so we get calls all the time from physicians claiming, furious that their resident, their patient, went to the hospital and we didn't notify them. Or in an independent living environment, well, it's not our right to notify that physician without that patient's consent of what happened. Well, they don't understand the privacy and the regulatory issues that exist within the category. So one is educating, I think, the physician community. The other is financial advisors and other trusted partners. So helping financial advisors, whether it be elder law attorney or estate planners, giving them information so that when they're having those conversations, this is a natural part of the discussion.
I would just add one more thing about how do we educate our clients, and it's really through the experience that we offer. So if we find we have online client acquisition and we have channels through some of the healthcare systems and partnerships, but one of the strongest things that we can do is provide an incredible experience in word of mouth referrals. We all live in our own little insular bubbles because we create them ourselves and we see the same people and we expose ourselves to the same thing. They do the same thing. So going to meet them where they are is really important.
I think the other part to add on top of that is, depending on what type of product that you're marketing to the senior, the more complex that it gets, the more that we find you need that face-to-face communication, that more of that experience. It's more of a team approach where you're bringing in nieces and nephews, and then even depending on what areas you're in, they may not be able to speak the language, so you get translators coming in out of Donors, you see a lot in the Chicago area. So the more complex that it is, the more confusing. I think the one part that we've seen a lot is that most wealth management firms only focus specifically on the assets themselves, but there's other products out there today, whether it's long-term care or single premium products or guaranteed income products that we're using. But what I tell a lot of our clients is it may not be one specific solution, but a group of them. It may be that the families be involved in certain things, but they're going to use the assets in other parts. But again, a lot of it, we're going back to basics of what we grew up, some of us knew in the 50s and 60s, but internally we use a lot of technology to be efficient, to be able to pay for that labor force.
Thank you. Kimberly, you mentioned at the previous talk that there's a shift from volume-based care to value and outcomes-based care, and that shift enables a whole bunch of different new go-to-market models and potentially makes new products possible where they weren't possible before. I just wanted to kind of gauge where we are in that transition, and have you actually had products that you green-lighted that you wouldn't have green-lighted 5 years ago? Do you have a sense of when that change will become real?
Well, I think it's going to be longer than I'd like for sure. But the new innovation that we launched last year in April, we have big health systems, small health systems, very keen, and many under contract. So they've signed up. In fact, we had one customer actually go on TV and say, we're the first ones in Maryland to adopt this new technology. But it's going to be a long ramp, because what happens is you've got systems and you've got interoperability, and you have to deal with, they have to deal with everything that they're trying to do. So I don't want to, I want to say, if anything, I was naive about how long it's going to take. But the compelling nature of the difference that it can save, like, so for example at HIMSS, I can share this because it's public now, We're doing work with partners who took the CareSage algorithm and ran it through their health system, and they said, wow, if I spent $1 million extra on interventions, new care models, new interventions, I could actually save $2 million. So let's invent together what that looks like. So, there's a great example. There's, people talking about it and signing deals, but it's going to be a journey for sure.
I'll go way up top.
Thank you. I'll try the microphone. I'm a financial advisor, and my specialty is retirement planning, and it seems like whether I'm working with someone who's 45 years old or 80 years old, and whether they're working or expected to work past what we call the normal retirement age or not, and whether they are what we would not call wealthy or whether they are what we would call wealthy. Approximately 100% of them are worried about running out of money sometime before they die. Except for you, Richard, the other 4 of you as panelists all have services that cost something to the individual. Can you, each of the 4 of you, talk about how much your service costs the end user?
Yeah, so our services run a pretty wide spectrum. Anywhere, I think that on an independent living side where you're paying for room and board and basic services, you could be paying anywhere from $1,500 New York in a Chicago or New York to $7,000 to $8,000 a month. In an assisted living environment, you're going to have your base rent, which could be $3,000, $3,500, and then you're going to have care. And care is going to be based on the acuity level of the individual, which may run anywhere from $500 to $1,500 on top of that. You go to Alzheimer's and dementia care, that cost is going to increase. And then as you go into traditional nursing home, long-term care, that number is going to go up even higher. I think the big challenge on affordability, and we just completed a study on this, is what we look at is the question of real affordability or the perception of affordability. And when you look at a certain level, when you're requiring more than 20 hours or more a week of non-medical home care services and all the other costs associated with maintaining a home, are you better off making that transition into a senior living environment, number one? And then number two, what are the resources available to help you pay for that, whether it be a veteran's benefit, whether it be your long-term care policy. In some states, they have Medicaid waiver programs that allow people to use Medicaid dollars to cover assisted living. So that's a pretty wide range for us.
It's a wide range for us as well. So if you think about non-medical home care as an industry, it's about 70% private pay, which alludes and aligns with your comments. The other 30% is either Medicaid or long-term care insurance primarily. So if you think about like what is happening, this is a great example of like middle America getting just kind of like thought about, you know, in the second term here. And so one of the things that we do very differently than typical industry today is that most of the time you have to buy or consume care in 4-hour increments or sometimes 6-hour increments, whereas in reality you may only need an hour and a half in the morning and an hour and a half in the evening, sun up, sundown service. So we do care for as little as 1 hour, and we also have an on-demand model, so you can get care for as little as 2 hours. Now, I would be naive if I didn't answer your real question, which is about how much does it cost. And so we do very geography-specific price points. It also depends on the credentials of our care professional that's being deployed into the home. Most of them have some sort of home health aide or CNA credential. But if you think about the cost compared to a skilled nursing facility or another stay, it's substantially lower because it's not actually 24-hour care that most people need to stay in their home. It's more like, 2 hours in the morning, 2 hours in the evening, and someone to run errands with them. So it has a wide variety of ranges, starting at an hourly rate up to a 24-hour rate that's available.
Yeah, but you're in a Harvard classroom now. You can't get away with that. You have to give numbers.
I'd be happy to chat with you after this.
So for me, we have subscription-based services for the most part, and they range from like $20 to $60. But where the future is going, I hope, is more in the innovative payment models that we've been doing, where we do risk sharing, so that $2 million of savings that I give to a health system, I can actually share some in a risk reward model. And so we're doing some of that as well, so that you can move out of the private pay zone and into more of a provide value to the entire system to take the costs down for everyone.
So making care easier is actually free for both family members as well as professionals. And I think that's one of the reasons we've been able to stay around. We actually make our revenue, we have a diversified revenue model where we knew that the internet has trained people to expect things for free. And so we make our revenues through product sales, through advertising, and through partnerships. And so we approached this market realizing that we weren't going to charge family members, we weren't going to charge the professionals, but how were we going to be able to make revenue outside of that?
Question largely directed at Will, but I think more broadly for other folks on the panel as well. So one of the greater challenges that we see looking at the community-based physical infrastructure environment, and you've talked a lot about different studies and tests and things you've been doing, is the absence of connectivity holistically through properties. So I wanted to ask you, but also for the panel, what do you think the driving force in our industry? It's always, what's the killer app? What's the thing that's going to drive connectivity universally for the people who are at the older end of this age bracket? You mentioned your residents are typically above 80. So
Great question. It is the adult children and the grandchildren. So the expectation coming in that I'm going to have unlimited wireless Wi-Fi access, that I'm going to be able, when I come visit mom or dad, my grandkids come, when the grandkids come to visit mom or dad, they have access to that technology, as well as I think we're continuing to see the seniors coming in with the expectation that that's available. I think the other thing that is driving it is some of the innovative payment models that are coming around affordable care. So is one of my beefs, and this is not a political statement, but Obamacare did a lot to drive technology adoption, EMARs, in the acute care side. A lot of money put aside for meaningful use. Not a lot of money was put aside for meaningful use for post-acute care, and no money was set aside for the senior living industry. So now all of a sudden you have assisted living communities that are being asked to participate in bundled payments. CCJR just came out, the joint replacement bundle just came out, and you're asking assisted living communities to serve as transitional care units. But then the participating, sponsoring hospital or physician practice is saying, yeah, well, we need to be able to exchange data real time. The communities haven't had the resources or the reason to make those investments. So I think you're going to have two reasons primarily. One is going to be consumer demand expectation. And two, I think it's going to be the continued evolution of the healthcare side and the integration of healthcare with senior living and post-acute care.
Just to echo Will's comments, I was actually at the Center for Medicare and Medicaid Innovation for several years, so these things are pretty close to my heart and my mind. No, it's great. I couldn't agree more. But one of the saddest things is that as Honor builds these partnerships with the acute care settings and post-acute care providers, we ask, where do you want the care notes to go after our care pro completes the visit? And there's not even a place in the medical record, or what is called pseudo-defined a medical record today, for this type of information to live. So we've totally whiffed it in regards to, as an industry, creating technology that's actually using information real time to alter our practices at the front lines.
Right there. So my question's about caregivers. So we've talked a lot about seniors, talked a little bit about clinicians, but the caregivers are the third leg on the stool, and maybe the most time compressed because they have elderly parents, young children, sometimes children with special needs. So what are the best practices that you're instituting to both A, sell to the caregivers, but B, maybe even more importantly, properly service them?
So this is actually, Making Care Easier is all about really and tailored to the caregivers themselves. And so we do everything from try to educate them. So when their mom breaks their leg, shatters her hip, and their life changes right away, we help educate them and provide tools to assist them from their immediate need to their long-term need, to actually developing tools that are going to address how they're living, the fact that they're many times, like you said, very stressed, they're still working, part of the sandwich generation, and we wanted to be able to provide accessibility, the tools that they're going to use, and we're be able to push that out so that they can really share the care and the burden of caring with not only themselves but everybody in their care team. And what we really want to try to do is approach the caregiver as a tool in helping the senior. And the fact that the caregiver themselves is the one that needs the education, the one that needs the tools, but more importantly, the one that is helping the senior. And as they continue to, and the family members are continuing to take on more and more responsibility for care, we try to continue to develop our tools and our offerings so that we continue to increase the help and the assistance that we're offering.
I would just say one more quick comment on this. It's not, our society doesn't think it's okay to outsource care for our parents. Like, no one wants to do that. That sounds like a pretty horrendous thing to do as an adult child. And so part of what we try to do is ease the information exchange between that adult child and the caregiver so it's real time, so that they're as connected as possible to what's happening in the home. But there is a societal stigma that we need to acknowledge, I guess, when considering these types of conversations.
We can go to no room and they'll back to the left.
Rich and others, the question is about long-term care insurance. 10 to 15 years ago, that was really the hot product. And all the insurance carriers now have boosted the rates on that. It's looking like a losing proposition. How do you fit yourselves into long-term care insurance? Do you find that you have a hard time getting reimbursement or applying for reimbursement? What's the future of this if the future of long-term care is non-institutional or only quasi-institutional? What are the insurance companies doing to modify their premium allocation or their payout allocation to accommodate this trend?
Yeah, it's a great question, and that's something that we're getting faced with a lot. I think what a lot of people are not aware of is that long-term care in itself, I think, started in 1974, so it's a relatively new product compared to when you look at life insurance that was around late 1800s. What the insurance companies had found was that, and they were expecting a certain amount of people to stop paying premiums and drop the policy like the life insurance industry does. What they found is people were actually keeping those policies in place, and I think it goes to answer exactly what everyone's seeing, is that everyone's realizing we're living much longer today. So your traditional long-term care policies, they're adjusting them now for inflation protection and things of that nature. Unfortunately, the premium's gone up to go and address those needs. What's also happened on top of it, which a lot of retirees are being affected with, is that with the low interest rate environment that we've been in for now a considerable period of time, not only is it affecting income, but it also affected the insurance company as well, because now they can't earn the monies they were expecting on top of that. And I think none of them ever expected the rates to stay as low as they are, and we're expecting to stay much longer. So I think what's happening, unfortunately, is you're seeing other products now that are coming out where people are being forced to put large amount of assets in place, whether this we call a single premium linked benefit, where a person maybe put $100,000 or $200,000 of their own money in there, but then they get double or triple the long-term care needs. So I think what's really happening is that people are being forced to move more of those assets for this kind of care, whether they like it or not. Unfortunately, it's reality, and that's what you're seeing. So we're doing a lot on the educational side of our life, especially the earlier that you get, to start putting money away even for those areas in itself. It's definitely a dilemma, and I think it goes back to what Will is saying, is that I think the country itself is not addressing the needs of this post-acute care, where the majority of care is being needed, and there's no dollars going to those funding. So I think it's going to have to be a combination of some public programs in addition to some innovative new products.
What about the providers? Kelsey, you were nodding your head, everything like that. What about reimbursements? Are you getting any reimbursements from insurers?
Yeah, so we actually do have a couple long-term care insurance companies who pay for honor care, but we do a lot of the legwork with the families. I was actually on the phone with a long-term care company that will remain nameless, and I said, if you're going to pay for these services, you should pay for services that you actually have a sense of transparency, that we have a 0% fraud rate, we will send you all the care notes, we will tell you everything that's going on. And he's like, I still don't understand why I would want to pay out for any service. And I said, it was like dead end. I can't do business with people like that. So it's a bit of a position that we're in as a long-term care insurance industry needs to evolve pretty quickly, and it's great to see folks like these companies coming out.
I think it's critical to make sure that you're dealing with a top-rated carrier, and it's one of the things that we tell our clients to make sure that you're using as a top-rated carrier. Because typically, if you're dealing with a top-rated carrier, a lot of times they're paying out, on those claims. But it's definitely a dilemma out there.
We're also beginning to see Medicare Advantage providers build benefits that pay for some of the traditional long-term care services, recognizing that assistance with ADLs, companionship, all have a direct impact on lowering healthcare costs. So if you think about it, if somebody needs help getting up, bathing, dressing, grooming, they're not there, they fall, they go to the ER, that's a $35,000 cost right there. A whole lot easier to partner with somebody like Honor and be able to provide that at a fraction of the cost. And we are seeing some Medicare Advantage plans doing pilots like that.
Yeah, great. So I am curious how we're going to measure our outcomes, our quality in the long-term care industry. We talk about some customer satisfaction, right? But as we start to think about partnering with healthcare systems, we know there's sort of a dearth of quality metrics that would be accountable for. And I'm wondering where you guys are seeing it going. Are there some frameworks that we can think about? Are there specific metrics out there? Where is sort of the quality metrics and the outcomes going in the long-term care industry?
So I'll put on my nerdy health policy days in DC when the Impact Act passed. And the Impact Act is a new law that's taking effect in several months. And it's actually to standardize the measures across post-acute care sites. So if you think about hospitals have HCAHPS, there's MDS, there's IRF-PI, there's OASIS, and there's no language that speaks across all of these today. And the Impact Act is designed to standardize some of those tools and collection items across them to ultimately report out to MedPAC, so then it's going to have payment policy implications from Medicare, and this is where site neutral payments and all these other things start to really make people quite nervous. So I would say, I'm not in this space today anymore of specifically long-term care, post-acute care quality measures. There is, I would say, advancements being made in this space that will allow for us to think about how do we measure quality. But I also think in the quality discussion, there's a lot of room for patient satisfaction versus medical outcome quality, and there's a lot of gray space that needs to be delineated between as we think about this moving forward.
Well, how about being real specific? Beyond the patient satisfaction metrics, what are some of your KPIs that you're really looking at?
Oh yeah, so absolutely. At Honor, we think about, where do we get our clients from? How long do they use Honor Care Services? How frequently do they use Honor Care Services? And then why do they churn, what we call churn, right? And one of the number one reasons why they churn is because they pass away. But fundamentally what we do on an interaction by interaction basis is that our care pros rate the family and the family rates the care pros. So it's a two-way street. So that we collect quality measures at every single patient encounter or client encounter that we have with the family. So that if it's a 5-star rating, we've actually picked up some abuse cases because the care pros rate the families so low, and because there's verbal abuse going on between the spouses at home. So we asked, why did you rate the family so low? And they said it's a horrible environment to work in. So what does that initiate us to do is adult protective services. So those are some of the types of measures and processes that we've put into place.
Go ahead. Yeah.
I'm curious about insurance that you get, for instance, Brookdale and insurance, for instance, on the employees that you have that work occasions. I don't know if you place anybody at homes. I know you have liability insurance for the actual premises, but I'm wondering also the level of healthcare support and whether you provide insurance for them also. So the kind of insurance you get to protect your business as well as providing any insurance to your employees.
Well, we don't do in-home.
Yeah.
So when we say that we provide private duty home care, that's really providing that service inside the four walls of our communities for residents and their families. So we're not, like an honor, having to deal with that. But just general liability and professional liability.
Okay, so the people you work are actually employees
Yeah.
of the company.
They are all
and you
employees
give
of the
benefits.
Yeah.
How about honor? How does that work?
Yeah, so Honor started out in a hybrid model where we had some contractors and some W-2, and as we continued to evolve, we realized that the model that was actually going to be best for the care professionals themselves was a W-2 model, so now we're transitioned to a W-2 model, which allows for us to have full benefits, a stake of equity in the company, teaching these individuals what does equity in a company mean, full liability.
The people who hire consultants?
No, they're W-2 status.
Oh, okay, they're actually employees,
Yep.
and you provide them insurance?
Yep, absolutely.
Okay, I think you went over a little bit what do you tend to use, like CNAs, healthcare provider, or LPNs? Who do you use as far as your nursing?
Yeah, certainly. So our labor pool, most of them have a home health aide, LVN in California, LPN everywhere else, CNAs, and then we have some folks who have no clinical credential but significant number of years of caregiving experience. So we're very fussy about who we actually bring onto the platform, which is why it's such a low percentage of acceptance.
And that's also all going to be state dependent.
Absolutely, yep. So this is a state-regulated, great point, industry that we're in.
And that's in California, right? Do you reckon that's the state of California regulatory?
Yep, but every state has their own regulatory
All
environment.
non-medical home care is regulated by the state, as is assisted living.
Right.
Is state.
Okay.
Julie made a point that caught my attention earlier, and I wondered if any of you, others of you have heard that, and that was, she said that people outside of the U.S. are using the more portable technologies more than here. I wondered if any of the analysts would agree with that, and what you think it might tell us about what's happening in the U.S. Is it a simple matter of the telecoms having too much influence and kind of throttling down the networks, or is, will it change? What impact might it have on our business? But most of all, do you think it's true? I don't hear people saying it, but I do think it's true.
So we get a ton of inbound email on a weekly basis of other countries wanting Honor to come there. And I can tell you from the level of interest that we've received inside the U.S. versus outside the U.S., it's significantly larger outside the U.S., in part because there's a market that exists here in the U.S. that's maybe, much more fragmented. There's 40,000 local agencies. So I do think that we are not paying attention as closely as we could to the international impact that we can have, that they're seeing at their company.
I think that what we're seeing is twofold. Number one, there's a quicker adaptation. People are adapting to mobile technologies quicker. And number two, a lot of the international plays that we're seeing, those are coming from countries that are poor. And the people with less income are more apt to actually use the mobile technology where they have a smartphone, they have a burner phone, they have a tablet, they use the free Wi-Fi versus actually having a full desktop versus actually using our www site. And so the poor countries are actually much more willing to use the mobile technologies first. And number two, even here in the United States, where some of the richer companies are, mobile technologies and tablets are becoming more and more prevalent. For Mother's Day, we just bought my mother a tablet, which is her first experience with it. She hasn't used it yet, but eventually she will. And so we're starting to see that more and more, so that, and Dave Austin talked a little bit about that in the main panel, and that the seniors themselves are actually using mobile and tablet technologies more and more.
Great.
And I would say it really varies by country. There's great differences all around the world. You know, Japan is way ahead and has some pretty cool robotic technologies looking at sensing emotion in the home for seniors and things like that. Korea as well. But in the poorer countries, they're looking to leverage mobile technology to really leapfrog and become innovative. So things like mobile ultrasound technology we've been taking to poor countries so that you can get the kind of care you need in pregnancy. So I think you've got a number of dynamics going on depending upon the country.
Great. With time, I think we're going to have a couple more questions, and then we'll let people come down and talk with the panelists before we have to go. So let me go. I'm going to go here, and then did you have a question too? I know you were raising your hand before.
Actually, I was just going to suggest, again, varying by country. There was a fantastic CEO of a group called Feros Care, F-E-R-O-S. They're in Australia. Because of the geography of the country, they are miles and miles and miles, and I mean that pun intended, ahead of us in terms of remote telehealth, wellness monitoring, and the services that they're providing, where the seniors there are very much active partners in their own care, because that's the way they're going to get it. When you have 12 hours to get to a caregiver, you're going to start doing a lot more yourself. So they're fantastic if you ever want to look into them. Wonderful group.
Let me go here, and then I'll go to you. Okay? I know you were waiting for something.
With dementia, 5 million people and 85 years old, 1 out of 3 suffers from dementia. You all deal with people that suffer from dementia. What would be the most important solution that you would look for to help you with dealing with patients with dementia?
Yeah. So we could spend a whole session talking about Alzheimer's. I tell you, the biggest challenge that we see, and I think this is one of the biggest issues we have facing our country right now, we're talking about this marketplace, we see that seniors are often struggling with Alzheimer's and dementia anywhere 4 to 8 years at home with their family before they're making the decision to transition to disability. And one, that's not, and I think it's because families feel the guilt that they can't abandon mom or dad. They have an obligation or responsibility to try to care for mom and dad. And I think changing the perception that it's okay for somebody that is living with dementia is still the person they were before. And that the family can actually go back to being the family by making these decisions to support individuals living with Alzheimer's. The biggest concern I have, though, is there's no payment model for that disease, and it's not a Medicare reimbursed disease in the sense of what is really needed to provide care for somebody with Alzheimer's and dementia. It's non-medical home care. And so I worry when I look at middle income, low income seniors, which is a large and growing segment of our population, those being diagnosed with Alzheimer's and dementia, what alternatives do they have? And right now, the alternative is to spend down your assets, qualify for Medicaid, and then do a Medicaid nursing home. And that's not, we can do better than that.
Yeah, I would definitely say from our end, what we find out is a lot of people either not aware of it or they don't want to face it, you know, as far as having this conversation. So when you bring up this conversation to a person, it's very tough, and especially, you know, us males, sometimes we get hard-headed and think it can't happen to us, and unfortunately it becomes too late at that point. And so usually what we see is the family, the primary caregiver, ends up becoming sometimes the ones that pass away first before the other because of all the stress that goes on. But I would agree with Will that there's this perception that they don't want to have them into another facility, but it's best probably sometimes for both at that time frame. But I think what we hear a lot is that the doctor comes back and says, you know what, the person's vitals are completely fine, and this could last now 7, 8, 9 years, maybe longer. And so how do you fund this? And so that's the big issue I think we have as a country is how do you fund this?
Last question here, and then we'll, people can come up and talk.
Thanks very much. I suppose this is primarily a question for Kelsey, and maybe Will might have an input as well. I used to run a home care provider in Ireland, and I always thought it was really important to be close to the client in terms of management and care oversight. Kelsey, the system, the platform sounds amazing, but how do you manage cases from a distance? And I suppose, Will, do you experience the advantage of having boots on the ground, for lack of a better word?
Yeah, so I would say we do have boots on the ground. There are care pros that are in the homes every day, and they give us care notes. And so not only do they give care notes back to the family or whoever the account owner is, but they also leave notes amongst themselves. And that really unifies this team around a home and around an individual and around a family. And then, I was on the plane yesterday today. I read through care notes today. We have open offices, and the care team sits right behind me, so I can hear client calls and care pro calls coming in. As we scale, right, that's going to become a bigger issue, and as a really great learning opportunity for us. How do we actually keep this local organization and this local flavor alive as we continue to scale across the U.S.?
I can think of so many examples where you get an angry call from a family member saying, "Your carer messed up. I want to see you right now in my house and explain what's happening." How is that going to work?
Yeah, we've actually never gotten that request of show up at my house and tell me what's happened. We have local management in LA, just like we have local management in San Francisco, and we'd be happy to, send the head of care management to the home to make sure that we resolve anything. But yeah, so far.
Maybe if I had your system in Ireland, I wouldn't have those calls.
Yeah, sorry.
and Will, obviously, your management is on the ground. Can you speak to me just very briefly, 30 seconds, the advantages of that?
Obviously, so one of the things that we know is from research that we've done is quality of staff and the relationship that the staff has with the resident and the family is what makes a successful community. We talk a lot about our industry, new construction and new supply coming on, concern with new supply. Growth is such that demand is going to continue to outpace supply, but even with new supply, it's not the real estate that's going to be the determining factor of whether or not a family makes a decision to move into a community or not. It's the quality of the staff and the relationship they can forge with people. Now, that being said, you still have social isolation within senior living. People can move into communities. I can't tell you the horror stories of families dropping their parent off, literally dropping their parent off, walking them to the front door, and you don't see them again. You're having to call to ask, when are you coming back to visit your loved one? And so there are opportunities, I think, to better leverage technology to create more engagement. Aging, at the end of the day, is a team sport, and you got to get a lot of people involved. And so boots on the ground matter, but you've got to find ways to connect with broader network.
Good questions. Thank you, panelists. Very illuminating. And for anybody who wants to stick around, the panelists will be here for approximately 45 seconds to a minute.
Yeah.
Perfect.